Hello, my awesome people, and welcome back to Pull Up a Chair. We're not currently in chairs, but that's okay because you can pull up a chair if you want to, but if you don't have to. Anyway, today we're going to be talking about medications. Sometimes this is a tricky topic. Who am I kidding? This is always a tricky topic. Whether you're the one taking them, or whether you're the kind of person who says that pills aren't antidepressants, taking a walk in the woods is an antidepressant. You're wrong if you're that person. Both of them can be. We'll get into that later. Anyway, Sam, what is our first point?
Diagnosis. I'm going to start out with a story. So I've had major depressive disorder since I was about 14, probably before then. And I wasn't diagnosed when I was 14. I saw therapists, I saw doctors, nobody gave me a diagnosis. It wasn't until college that my university counselor set me up with a psychiatrist. I took the test. I was terrified. Okay, so I was terrified. I called my dad crying. I panicked over the meeting. I was wondering what was wrong with me. I knew I had depression, but I was wondering if this diagnosis was going to be a life sentence. I worked so hard, and I was just panicking. Went to the hospital and saw my psychiatrist. I did their little test thing, and she looks at it, and she goes, "Yeah, you have depression. We're going to help you with this." That's easy. That was that easy. But it took years because no one would ask me what I wanted. I told my counselor that I don't want medication until I'm ready to have medication. And she goes, "Okay, well, the first thing you need to do is get a diagnosis." And that was terrifying to me. But I chose to do it because what I was doing wasn't helping. It wasn't enough for me. And my diagnosis really was a silver lining in the whole medication process.
My diagnosis was a little bit different because I got diagnosed with both anxiety and depression at the same time in the same way that Sam did, except I did both tests at the same time. It was something I had been talking about with my mom for a couple of years maybe. We had always thought about it, and I'd also had thyroid issues, which I still will have my entire life. And I know that sometimes depression can be a symptom of that. So when I took the test, I was just check-marking off everything. And the doctor goes, "Yeah, we're going to get you medications for this. And we're going to start seeing, a therapist." And it was a pretty easy process, and it was just fine. And I didn't have to, I say that I was years, I don't remember when this happened because it was so long ago. This was probably when I was in eighth grade. So I don't remember it exactly, but as soon as we started thinking that I might have depression, I was pretty much seen right away. So they can go either way. It just depends on where you are, who you're seeing, and, stuff like that. But if you're afraid that someone's not going to diagnose you and you really believe that, not that I believe in self-diagnosis unless you do a shit ton of research, but if you really think that and the doctors are kind of iffy, you can tell them that I want to know why I feel this way. You can be insistent with them. They're supposed to be there to help you. That is supposed to be their job. I'm not trying to tell people how to do their job, and I'm not saying that, you should be rude to the doctors. I'm just saying you should do what you can to get the help that you need.
After the diagnosis process, your psychiatrist is going to take you through a list of medication that they believe is best for you. Now, there are 1.5 million depression medications. There's 1.5 million anxiety medications. The psychiatrist, their job specifically is to listen to your symptoms and figure out which medication is best for you. That is their job. And they're gonna sit with you and they're gonna say, well, here's these 3 meds. Here are the side effects of these meds. Here's what they fix. Here's what they might not fix. Here's why I think it would work for you. And based on all of those, you decide. You have the ultimate decision of what you are going to be taking. Now, when I did it, I was put on a couple different ones. I think I was put on 2 different ones. And the medication trial period is they tell you to take the medication for, some meds you take twice a day, some you only take once a day, some you take once every 2 days. You take it as prescribed for 4 to 6 weeks, they say.
Yep, about that.
And you have to take it consistently, or else it doesn't work, because it has to build up in your system. Because, like with depression meds, it's going to take a few weeks for that medication to really build up in your system and start working. And throughout that period, you're supposed to be documenting everything. And it is a hassle. It is mind fuck. Okay? Because sometimes it's like, I feel better, but is that the medication? Because I've only been taking it for like a week? Or is that just a good day? Or, it can be 4 weeks and you're like, I feel really awful today, my meds aren't working. Or, you're like, is this the meds? Am I having a side effect? Or am I having an anxiety attack? Or is this something new? And you don't really know. And that's things you have to talk to your doctor about. Just mark them all, write them all down. Write them all down. Everything. Even if you think it's trivial. And then you go in and you tell them, well, here's what I've experienced. Do I feel any better? Yes or no? And here's my side effects. Here's, how I've been taking them, what problems I have, da 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 da. And your psychiatrist, based on those answers, based on, your blood levels and all of that, is going to go, okay, do you need a med increase? Do you need a med decrease? Is this medication not really working for you? Then we start a different one, or we start a new, dose of it, and then the trial period keeps going until you find really what's good for you. And it's a long process. It's like almost a year. Almost a year, maybe 2. It depends on how your mental illness changes. Really.
The first time I had one of my anxiety/antidepressant meds, it worked for a little while, and then my anxiety got worse. They tried to increase it or something like that. I had tried out my first med, and it made me really, I felt really angry, and I hated that feeling. So then we had to start a different one, and it was a whole new, everything was different with that particular one, because the other one made me more hungry and this one made me less hungry, and I wouldn't eat. There were literally times I would sit in my high school cafeteria and just not eat, and my friends would be like, well, are you okay? And I'd be like, I'm just not hungry, and I think it's because of my meds. And then I've been taking that same med for a while now, and my anxiety has, increased with age, because, as you get older, things are more stressful. And now I have been put on a new medication. to alongside of that. So that's a whole nother testing process that I have to do. And it probably would have been a lot more helpful if I had written things down, which I hadn't done at the time because I was in high school. I didn't know I didn't know anything, you know? And they're not, the point that I would like to, you know, focus on as far as this goes is that I know a lot of people say, oh, they're just trying to push pills onto you, and that's kind of true, but not necessarily, because you do ultimately have a choice. If you don't want to take meds, you don't have to. If you want to just do therapy, that's fine. If you don't want to do therapy and you just want to do meds, not recommended, but technically, yes, you can do it.
Mm-hmm. Yeah.
And you can take whatever pills are best for you if that's what you decide. And you don't necessarily have to do any of it if you don't want to.
Yeah. Remember my first experience with a university counselor? She looked at my sheet and she said, yes, you have depression. I recommend you take medication. And this was a person who checked her phone every 20 minutes while we were in session. She didn't listen to anything. She didn't have anything new for me, any coping mechanisms, nothing. Every session with her was, you should be on medication. You should be on medication. And I fought her because I wasn't ready. You have a choice. Do not let anyone influence you on that. It is your choice. Serious.
Seriously.
Yeah.
Some people, some doctors will do that.
Mm-hmm. And because there's a lot that goes into taking medication. Like side effects. Side effects is a huge one. My Wellbutrin suppresses my appetite, so I don't eat a lot, and I'm pretty skinny as it is. My Prozac used to make me nauseous, just horribly. Especially if I took it at night, I had to take it in the morning. My Lexapro makes me have the craziest dreams, like the craziest dreams. And those are very slight side effects. Some people gain weight, some people lose weight horribly, some people get the shakes. My Wellbutrin sometimes gives me hand tremors, you know, and there can be some serious side effects. This isn't something to mess around with.
Sometimes those meds can make you even more, you know, if you have suicidal problems, they can make you more depressed or more anxious or more suicidal. And that's something that you really need to talk to your doctor with as soon as you possibly can, because those are things that are life-threatening. And like, a lot of meds that I take put me to sleep, basically. I have like nightmare meds for PTSD. I have 2 different kinds of anxiety meds. I have my thyroid medication. There's birth control, and birth control is a whole thing that can mess with everything else if you're not, you know, careful. Not saying that it will, but it can. And, you know, if you don't take all of these, you know, medications the way you're supposed to, those side effects can increase. Mm-hmm. So it's really important.
Yeah.
And I know that I am a hypocrite about that because I don't do very well taking my meds, and there are ways you can remember, and we might go through that in a different video. But there's a lot of things that you can do. There's a lot of mental health apps that can help with that. Alarms, pill boxes are helpful, or just having someone remind you. But you know, just do your best, because it really helps.
And taking meds, it changes your daily routine. Is that suddenly you have this new thing to do every day. And consistently taking your meds is like super important. Like the most important thing you can do to feel better. And when you first get into your medication, it's very important to take them every day. So that if you have a side effect, you know about it. Or if it's working, you are pleasantly surprised one day. Also, that's another thing about medication. It is not It is not a fix-all. It is not going to suddenly make you feel better. It is going to gradually make you feel better to where you don't even notice the change until one day you wake up and you're like, I feel really good. And I felt really good for a little while. And that's your meds. And I've had that happen, and it's great.
Another thing is like misdiagnosis. I don't think I've experienced this, but I know that it's been a problem, especially for people who need diagnosis for autism. Sometimes they get diagnosed with a bunch of other mental illnesses before they actually realize that they're autistic, and you have to go to like an autistic specialist for that. I'm not going to get into that. I'm really generalizing it here because I don't personally know a lot about it. I know someone who does, and they've just kind of told me their stories. I can't really get into it. So if I am incorrect on anything, I apologize. I am not trying to spread misinformation. I am just kind of sharing experiences that I've had or that I've heard from other people.
My diagnosis for depression was slightly a misdiagnosis. I recently spent some time in a hospital, and we'll talk about that. We'll talk about hospital visits
Much later.
Much later. But the psychiatrist at the hospital asked me if I had ever heard of borderline personality disorder. And it's a disorder that someone develops based on trauma in their past. And I looked at him and I was just like, that doesn't, I'm not that crazy, until he gave me the information on it. And I really started asking my friends and my family, because the things that I had been doing, I didn't realize were symptoms of that specific disorder. So I still have major depressive disorder. I asked him about that. I'm like, does that mean I don't have depression? And he goes, no, I do believe that you have major depressive disorder, but I also believe that your major depressive disorder is based on your borderline personality disorder. And it was a hit, because I had been working on my depression for so long to find out that I really should have, my doctors really should have been focusing, or they maybe didn't even see it, because I sure as hell didn't. And it felt like I had, been duped a little bit. But I am now focusing on that diagnosis, and it's working a little bit. That misdiagnosis really hit home with me, and it freaked me out for a really long time. I panicked about it, but that's just part of the process of diagnosis. And they gave me new medication and all of that.
A lot of people don't realize is that mental illness and taking care of yourself is a full-time job, especially if you have multiple ones. Because it just affects every single aspect of your life.
Yeah.
It really does, whether you realize it or not. In most cases, it affects everything. Because sometimes you can't get up. Sometimes you can't eat. Sometimes you don't take care of yourself hygiene-wise. And that really affects you in the long run.
And you can work so hard, but you can only work so hard. Is that when I first got on medication, it was because I was doing everything right. I was bullet journaling, I was exercising, I was eating okay, I was sleeping okay, and I still just couldn't get out of the slump. And my counselor said, maybe you need medication. Maybe you just don't your brain isn't producing the chemicals that you need. And of course, I worried about, what people would think about that. Because there's, God, every time I think about the stigma of that, I think about that stupid meme on Facebook where it's got the picture of the forest and the picture of the medication and the picture of the forest, and it says, this isn't an antidepressant, this is, meaning people who are depressed just need to go outside. Or that stupid one with the shoes, people who are depressed don't need something that rattles, they need shoes, or they need a good pair of running shoes and a nice day. And no.
No. Because while those things do help, don't get me wrong, going outside and exercising really does help. And sometimes that can be enough for people. But don't, diss medications because those can really help, And, don't let other people and their stupid stigmas dictate what you take or what you don't take or what you do to help yourself. Whatever works for you, works for you. It doesn't always mean it's going to work for other people, and sometimes it does. And don't let anyone tell you otherwise, unless it's your doctor. That's different.
It's kind of, medication and mental illness is kind of like baking a cake. You have all these ingredients, and if you don't have, homemade happy chemicals, store-bought is fine. So, why not do that? If you choose to. Not everybody puts eggs in their cake. Not everybody needs to take medication. But some people really need the eggs in their cake.
Some people really need the medication.
And it's okay to be scared about it. It's okay to, hesitate. You take your time. But it's your choice. Don't let anyone else influence you in doing so.
All of your feelings about all of it are completely and 100% valid 100% of the time. Behaviors is a different story, but your feelings are valid.
Yep.
And kind of points that I want to stress, if anything that you take out of this video is that medications can be important, but they are not a quick fix. No one's ever claiming them to be a quick fix. Most of the time, you need to do therapy and lifestyle changes and lots of things in order to potentially maybe overcoming mental illness or at least making it manageable. And also to not let people tell you how to live your life. If you are doing the best that you can to help yourself, that's all that matters. As long as it's not at the expense of other people, it is not bad, it is not selfish, and it is totally 100% worth it.
One more thing about the medication not being a fix-all. You have an illness, okay? Mental illness is an illness. Your brain is sick. You wouldn't tell a person with diabetes just to take their insulin and they'll feel 100% better. People with diabetes need to check their blood sugar, they need to eat well, because if they don't, the insulin isn't going to work very well. So with medication, you have to take your medication, but you also have to, if you want to be healthier, you got to try. And I understand not being able to try. I get that. I really get that. We all have those days, and I hate that phrase. But
for people who are mentally ill, that phrase really hits home.
Yes.
Because all of us who are mentally ill, we do have those days. And that's okay. You can come back from those days.
Yes, you can.
But anyway, that is all the time that we have. This is probably a very long video, and I'm very sorry about that. But I hope you got a lot of good information. I hope you feel better about any situations you might be in regarding this topic. And that, you just feel better, hopefully, in general. Hopefully this was able to help you in some way, even just a tiny bit. But thank you so much for watching. Thank you for liking and commenting and sharing, and anything that you have any suggestions for or comments, whatever, leave down below. If you don't comment, I won't know what you're thinking. And that is really all the time that we have, so thank you for watching, and I will see you all in the next video. Bye!